If you're within 10 years of qualifying for Medicare, it's important to know that Medicare doesn't cover all of your health expenses. It's more like 50%. Are you confused? Well, you're not alone. A Merrill Lynch Age Wave study found that only 7% of individuals aged 55 to 64 said they felt very knowledgeable about Medicare coverage options. Wendy Roman is here with some answers. Welcome, Wendy. So let's go ahead and break this down for folks. What are some of the different types of coverage under traditional Medicare?
So traditional Medicare has Part A, which is hospital coverage, Part B, which covers for visits with physicians, lab tests, medical equipment, Part C, which is literally the option to be able to choose a Medicare Advantage plan, and then Part D, which is your prescription drug plans.
Wow, so 4 parts for folks to remember here. Okay, so let's start off. What are some of the items that are not covered with A?
So with Part A, that's your hospital insurance. So one thing that a lot of folks get confused, if you're in the hospital, those surgeons or physicians that are tending to you while you're in hospital, they'll bill you separately. That doesn't come under your hospital insurance. That's actually under your Part B coverage. So the hospital coverage, Part A, is just really for your inpatient hospital stay and what those costs are.
Does Part A cover, let's say, nursing home or custodial care?
So Part A will cover what they call skilled nursing care, and that is when a person's released from the hospital, but they do need to receive additional care, and they received care so it's medically necessary so that they can recover. For that, a person would then need doctor's orders. That is covered. But for a person to receive what they call custodial care, which is non-skilled care, and is for assistance with those daily living activities, that is not covered under Part A.
Okay, so let's go on to now Part B. As you said, Part B covers physician services and testing. So what is typically not covered in Part B?
So in Part B, things like dentures, hearing exams, what we call routine hearing exams, eye exams for the prescriptions of eyeglasses. Okay. Those types of services are not covered.
And also Medicare does not cover some bigger items like dental and eye exams, as you mentioned.
Yes. So routine eye exams for just to prescribe eyeglasses, those are not covered. Dentures, dental services, acupuncture, cosmetic surgery, those types of services, they're not covered under Part B.
Okay. Now let's talk about nursing homes. Medicare does not cover care in the long-term care in nursing homes, correct?
That's correct.
I think a lot of people are confused by that. They think that it does.
It is kind of confusing. So one of the things is Medicare will not cover skilled nursing in a nursing home, first of all, if you have not been an inpatient in the hospital for 3 days. Okay. So if you haven't been inpatient for a total of 3 days, then your coverage under skilled nursing with Part A of Medicare will not begin. So that's one of those requirements. And also the custodial care that you had mentioned, that is when a person needs daily care. It's not rehabilitative in nature. It is not a service, skilled nursing service, where the person is on their way to recovery.
So a lot of criteria, it sounds like a lot of criteria needs to be met. This is a lot of information to get out there. We've talked about a lot of things that it doesn't cover, and certainly there are a lot of things that Medicare does cover. Where can people get some more information if they want to try to navigate this?
Absolutely. People can get more information at www.medicare.gov, or they can go to state organizations like here in the state of Florida, we have SHINE.
Wow, Wendy, that is a lot of information for people to absorb. Thank you very much for being here with us today.
You're welcome.
And hopefully you have learned something about Part A, B, C, and D for Medicare and what they do and do not cover.